about the visual pathway and the diagnosis of lesions. Okay, can you please move on? Okay, so what is a visual pathway? The visual pathway is a pathway over which a visual sensation is transmitted from the retina to the brain. And this includes the cornea and the lens that focuses images on the retina and nerve fibers that carry the visual sensations from the retina through to the optic nerve. So it is the way in which an image is projected, or a message of an image is passed from our eyes. The moment our eyes, the light reflects into our eyes, so they pass on that message through the optic nerve all the way to the brain. So the pathway in which that signal moves is called a visual pathway. Next. Okay, so the nerve, for up, please, job. Yes. So the nerve fibers from different areas of the retina become more organized as they pass down the optic nerve. So then the optic nerves from each eye meet at the optic chiasm, a structure at the base of the brain. And then at this point, the nerve fibers which are associated with the nasal half of the retina from each eye cross over, so that on leaving the optic chiasm and passing into the optic tracts, the nerve fibers from the nasal retina of one eye travel down the optic tract, with the nerve fibers originating in the temporal retina of the other eye. At the end of each optic tract, the retinal nerve fibers connect with other visual pathway nerves in a structure called the lateral geniculate nucleus, located in the midbrain. And then some processing of the electrical signals occur in the lateral geniculate nucleus before a series of radiating nerve fibers. The optic radiation convey the message to the visual cortex in the posterior portion of the occipital lobe. Perception of sight ultimately derives from processing within this and adjacent areas of the brain. So then basically we can say the message is finally it's taken to the visual cortex at the back of the brain. So it's there at the back of the brain. So here we have a picture of explaining what I just read. So as you can see, the eye is divided into the nasal retina, which is the middle parts of the eye, and then the temporal retina, which is on the outer sides of the eye. So then, as you can see, the nerves, the nasal retina nerves come and cross and meet at the optic chiasm. And then the temporal retina nerves move on the outside and come and connect with other nerves here in the lateral geniculate nucleus, and then continue to the primary visual cortex, which is, like I said, at the back posterior part of the brain. So that's how the pathway, the visual pathway is. This is the anatomy of the visual pathway. This is how once light is reflected into the eyes, then the message is passed on through these nerves, and then all the way to the posterior part of the brain, which is the visual cortex. And then the message is interpreted by the brain and then passed forward, which is now what makes out the vision or the visual image of what we see. And then it's interpreted. Okay, moving on. So then we're going to talk about optic lesions. What are optic lesions? So generally, a lesion is any damage or abnormal change in the tissue of an organism, usually caused by a disease or trauma. So any damage that is caused in a tissue of a certain body part is called a lesion. So then we can easily make out that an optic nerve lesion is an abnormal change or damage to any part of the optic nerve. So it's damage or breakage to any part of the optic nerve. So that's what an optic lesion is. So then there are different kinds of optic lesions. We have optic nerve lesions, we have optic chiasm lesions, which means breakage in the optic nerve, and then breakage in the optic chiasm, and then a lesion at the optic tract, lesion at the lateral geniculate regions, and then lesions at the visual cortex. So those are the different types of optic lesions we have. So then here, this picture shows when there's different lesions at different parts of the optic nerve, what diseases or defects they cause. Because when there's a lesion at a certain place, it causes a defect or it causes a disease. Because when we have a lesion in the optic nerve, at the part where we have that lesion, there's a certain damage, which means a certain message or a certain part message is not passed through, which means some of the information that was received from the eyes will not reach the visual cortex, which means the message will not be interpreted properly. So then the person will not be able to see clearly the image they are looking at. So that's when blindness in one eye occurs. That's when maybe someone can be looking at something, but then there's a dark or a shaded part in their vision. That's when, so once we look at this picture, the first part, you can see where the first lesion is. It causes total blindness of the right eye due to the complete lesion of the right optic nerve. So if you see, the right eye is that side. So there, thank you. So that lesion there causes that the right eye, what the right eye sees or the message that the right eye receives will not be passed through the nerve all the way to the visual cortex for it to be able to be interpreted and for the right eye vision to be seen. So which means when the person looks at something, when there is a lesion in that part of the optic nerve, their right eye will be dark. It's like closing your right eye and then opening your left eye, and that's what that person sees. So then the second one is the right nasal, it's called right nasal hemiatopia due to the lesion involving the right perichiasmal area. So if we see it, number 2 is there, by there, which means the reason why it's nasal is, like I said, the nasal nerves, if you guys remember the first picture, the nasal region or the nasal part of the eye, those nerves are the ones that, thank you, Job, nerves are the ones that cross. You see at the optic chiasm, the nasal retina nerves are the ones that cross at the optic chiasm. So which means if there is damage there at the right one, that means the right eye, it will cause hemiatopia. I think that's how it's pronounced. Yes, that's what it will cause there at the chiasm. Okay, Job, can we go back to the picture, please? So yeah, that's now what number 2 is, the hemianopia. Okay, that's what it causes. So it's like the person will be looking at something, and then somehow it's like the vision of the right eye will be divided in two, and then the vision, the half that is on the inner side of the eye will be dark, which means their right eye, if they close their left eye and try to look at something with their right eye, only the vision, they'll only be able to see the things on the outer side of the eye. But when it comes to the inner half of right eye, they will not be able, like how you see the shaded pink area. So we move on to number 3. This is bipolar hemianopia. What is this word? Hemianopia due to midline chiasmal lesions. So this is number 3. So number 3 divides directly in the middle, which means it affects the both nasal retina nerves. So it means it will cause blindness in dark blindness in the outer sides of the eyes, as you can see these shaded areas here. So then number 4 is the left homonymous hemiopnia due to lesion or pressure on the right optic tract. So number 4 is here due to this part here. So when there's a lesion in that area where number 4 shows, then this causes the left half of both eyes not to be able to see. Okay. And then we have number 5, that is left homonous inferior quadrantanopia due to involvement of lower right optic radiation. So here in number 5, you see that the lower right area where the nerves are, if there is a lesion there, and it causes that type of vision. whereby it's like there are dark areas in the lower left corners of your eyes. When you look at something, it's like in the lower left corners of your eye vision, you can barely see anything. It's dark there. It's like there's a dark shade there. And then it's similar to the thing in number 6. Is this that number 6, it's due to the involvement of upper right optic radiations. So since it's in the upper right, then you only be able to, the upper corners of your eyes, you will not be able to see. It's like there'll be a dark shade there or something dark blocking that vision over there. And then the final one, we have left homonymous hemianopia, which is due to the lesions of the right occipital lobe. As you can see, number 7 over here, due to that, a lesion in the right occipital lobe. And the occipital lobe is where the visual cortex is, right? So that right in that area, it causes dark side in half, on the left half of your eyes. So when you look at something, it's like on the left half of each eye is like there's a dark shade over there. So that's what people suffering from that defect, they see. Okay, we can move on. Okay, so the diagnosis, this is just basically what is used to diagnose, what instruments or instrumental diagnosis is used to diagnose these defects. They use visual field testing, they use confrontation test, they use perimetry, they use magnetic resonance imaging, and computer tomography scan, the CT scan. So these are the instruments or the things they use to diagnose the defects or lesions in the optic nerve that causes these defects. So yeah. So that's all for today. Thank you. So any questions?
Maria, thanks for your presentation. Because your first lecture, I want to mark the second mark 5 to you, only to you. Second mark 5.
Thank you.
Repeat, please, the slide with many pictures of gemianopia. Ниже. Ок. Джо, поможешь мне переводить?
Хорошо.
Гемианопсия. Пациент не видит половины полей зрения.
Homonymous lesion. Herniopia.
Хемианопия. Пациент не видит половины поля зрения.
The patient cannot see half of the area of vision.
Например, при опухоли гипофиза,
a tumor at the hypophysis.
On this picture number 3, the compressed the chiasma optici, and patient have bipolar, bitemporal, bilateral hemianopia. The patient do not view the lateral side of your vision. Patient don't, the red color is not vision. Anopia. If patient have the tumor of hypophysis, the patient
with the tumor of the hypophysis.
The patient do not have vision in the bitemporal left and right their vision. If the compress the nervus opticus, for example, the tumor of the глазница,
if we have a tumor of the eye,
anopia. If the tumor of the stroke in the left затылочная доля, левая затылочная доля,
левая,
left, затылок,
да, left. Мгм.
а затылок как?
The
Left occipitalis. Left occipitalis localization. The patient do not view the left plus left hemisphere of vision. Thank you. We redirect the Zoom and listen.